Hello, Assalamu alaikum, everyone. This is the fourth video lecture of Thanatology. And in this lecture, we'll try to learn what do you mean by the causes of death. That means the natural or unnatural causes of death. And what is suspended animation, and what are various conditions which simulate suspended animation. So this understanding is very necessary because while certifying death, we should take care of this condition also so that we can certify death with certainty. Then we'll try to learn what are the causes of sudden death and what is meant by sudden death. So this lecture will be on these topics, and this will help in understanding the causes of death and differentiate how to differentiate it from the suspended animation and what are the causes of sudden death. Okay. Hello and assalamu alaikum everyone. Bismillahir Rahmanir Rahim. This is the fourth lecture on thanatology. And in continuation of the previous lectures, this will add up the understanding about the death and the phenomena which are related with the death at the moment of death. Previously, we got the basic understanding about the subject, what is forensic medicine, and what do you mean by thanatology. We try to understand the definition of death, and before that, we should understand what life is. And basically, life is based on the three vital system, which are the tripod of life. And this is the gateway to that, that is the atrium mortis. And we discussed about the two phases of death. That is the somatic or the clinical death, which is the death of the body at the time of cessation of the vital functions of the body. Then the molecular or the organic death, which is necessary in understanding with organ transplantation. Then we discussed the signs and the diagnosis of the death and what was brain death. So in this lecture, we will be discussing the causes of death. And at the end of lecture, our learning objectives will be that we will be able to understand what are the causes of death and how can we differentiate it from the suspended animation, and what are various conditions which are simulating, and they are the differential diagnosis of suspended animation. Then what is meant by cause of death? Natural cause of death, causes of death, and unnatural causes of death. Then what is meant by mode of death? And we'll also try to discuss about the sudden death and what are various causes which lead to sudden death. So now, starting with the today's topic, the cause of death. The cause of death may be natural due to some disease process, or it may be unnatural because of the damage to any vital process which leads to interference with the functions necessary for life. Then about natural causes, The causes can be in various systems of the body, like the diseases in the central nervous system, hemorrhages, natural apoplexy or the rupture of the vessel in an organ, aneurysms, and other diseases of CNS, central nervous system, are the tumors, the cerebral hemorrhages, the subarachnoid hemorrhages, epilepsy. So these are various diseases which are in the central nervous system and which can lead to death, like cerebral thrombosis, cerebral embolism, meningitis, tumors, metabolic disorders affecting the brain function. So these are various natural causes within the central nervous system. Then there may be the causes within the cardiovascular system, myocardial infarction, or other ischemic heart diseases, or other diseases which can lead to severe malfunction and not compromising with the life. Then certain respiratory conditions, disease, asthma, COPD, or any other diseases which can interfere with the vital function of the respiratory system and can lead to death. Then talking about the unnatural causes many, like accidental, homicidal, suicidal, and poisoning. So any accidental causes like the head injury in road traffic accident or homicidal injury, the head injuries, the stab injuries, lacerated wounds on the vital regions, incised wounds, firearm wounds affecting the vital system, then suicidal firearm injury, suicide head injury, or any suicidal injuries which can interfere with the vital functions will be the natural cause. Then the poisoning, all the poisons which interfere the vital functions can be the unnatural cause of death. Now, little bit about suspended animation. Suspended animation are also called as apparent death. And we have to understand what suspended animation is, because there are certain conditions which simulate suspended animation and they become the differential diagnosis of death and suspended animation. So suspended animation is a state resembling this, in which the vital functions of the body are dropped to a minimum level, but compatible with life. That means the vital functions have been dropped to such a minimal level that they are compatible with life, but person appears apparently dead, but he is living. And in this condition, the vital functions of the body cannot be detected by routine methods of clinical examination. So the vital functions are such a low ebb that the routine clinical examination cannot manifest them. So it appears as the person is dead. So this state of suspended animation or apparent death may persist from seconds to several minutes, after which the person survives. This condition may be artificially induced as voluntary in yogis. The person doing the yogas can enter into such a state of suspended animation that the vital functions become at such a low ebb they are not perceptible. Or involuntary, we have seen in certain conditions that the body enters into a state of apparent death. The involuntary unnatural conditions are like electrocution, drowning, hypothermia, encephalitis, overdosage of sedatives, barbiturate coma, newborn babies after anesthesia, cerebral concussion, heat stroke, prolonged illness, deep shock. So these were the unnatural conditions. But the natural conditions of suspended animation are this condition, the death-like state is normally seen in cold-blooded animals like frogs during hibernation. Then yogis voluntarily induce it in themselves by practicing yoga. So these are the conditions which can be artificially induced, but naturally the animals, cold-blooded animals during hibernation show this phenomena. To differentiate between death and disapparent death or suspended animation or death-like state, routine clinical examination only are not sufficient. So EEG, ECG are also required, which will perceive the activity of the brain and heart, and it will settle the issue. So this is an important tip because there may be certain conditions during which such an state we can come across. So for the young doctors working in ICUs and whenever they are called for to certify death, these are few conditions in which the resuscitation measures should be continued more than half an hour when the person is clinically declared dead, like electric shock, barbiturate poisoning, and drowning. Now, the modes of death. What we mean by the modes? The modes are basically loss of tripod of life. As we know, the three basic vital functions is the tripod of life. Like the central nervous system, the circulatory system, the respiratory system, they all are three are tripod of life, and they make life possible. And the cessation of any one of these systems is gateway to death. That is known as atria mortis. So there are basically three modes which are based on these three vital systems. The first, coma, that is due to failure of the function of the central nervous system, the brain. Syncope, failure of the function of the heart and circulation. And the third is asphyxia, failure of the function of the respiratory function. So the mode of death are three. Causes can be many. Causes can be natural, causes can be unnatural, many diseases, many unnatural conditions, but the modes of death remains three: coma, syncope, and asphyxia. Coma is failure to the function of the brain and irreversible damage to the vital centers in the brain stem. And these may be due to raised intracranial pressure because of injury, because of infections, meningitis, poisons, metabolic disorders. And at autopsy, there will be edema and congestion of the brain and membranes. Then syncope is due to the failure of the function of the heart due to decreased flow of blood to the brain and leading to hypoxia of the brain. And these conditions can be due to diseases of the heart, diseases of the blood, hemorrhage, and certain poisons, and many other conditions which lead to the circulatory collapse. And at postmortem, we'll see the pale organs and the capillaries will be congested. Then asphyxia. Asphyxia is death due to failure of the respiratory system. And this may be due to infections, pneumonia, paralysis of the center, opium poisoning, breathing of irrespirable gases, or any penetrating injury into the chest, traumatic asphyxia, and at autopsy, the cyanosis, petechial hemorrhages, visceral congestion, and injury mark to the neck may be visible. So these are the postmortem findings, which may vary depending upon the condition to condition, but these are generalized. So there are three modes of death: coma, syncope, and asphyxia. Coma is because of the failure of the central nervous system. Syncope is because of the failure of the circulatory system, and asphyxia is because of the failure of the respiratory system. Thank you very much. In the next coming lecture, we will be discussing thanatology in continuation with this. Allah Hafiz. Take care.